The ICL stands for an Implantable Collamer Lens, and essentially it's a biocompatible material called Collamer that we insert into the eye via a tiny opening. Comes customized to correct the patient's prescription. The EVO ICL is suitable for patients who are myopic, and the range of treatment is from -1 up to -20. And then for astigmatism, we can treat up to -6. Procedure itself takes about 5 to 10 minutes per eye. We tend to do both eyes the same day these days, and the recovery is super quick. So most patients by the next day have noticed a marked difference in their vision. Our patients go home the same day. They don't need to stay in overnight. We call them the next day so that they don't need to come back physically to come and see us. And then we see them in the clinic 2 to 3 weeks later. We do more tests at that point, make sure everything's all right, make sure the ICL's sitting as it should, make sure they see well, and just ensure that everything is settling as it should. And then we see them again in about 3 months, and then again at a year. The ICL procedure is very safe. Over 2 million have been put in worldwide. The risks are typically less than 1%, and even if there are problems that develop, as long as they're recognized and managed, there's no detriment to the vision. LASIK is the most common elective procedure in the world. It's a laser vision correction procedure, and what we do there is we typically make a flap in the cornea. We then reflect that flap. The laser then sculpts the eye to the right prescription. The flap goes back, and that kind of tricks the eye into thinking nothing's happened. The recovery is very quick, so most patients the next day, they're seeing very well. The ICL is an implant, so we're not doing anything to the cornea. We're not touching the cornea in terms of changing its shape. We are inserting a small biocompatible bit of Collamer material into the eye and correcting the prescription in that manner. One of the big differences with the ICL compared to LASIK is that with the ICL, you can go in and remove that implant. Whereas with laser vision correction, once that cornea is molded, that's it, that's the shape it's going to take, it's not reversible. Patients describe their vision post-ICL implants as amazing. They are literally stunned by the results. Because their prescriptions are so high, they wake up in the morning not seeing anything until they put on their glasses. So now for the first time, they're waking up and they're seeing the world and all the details and everything they couldn't see before. This ICL is life-changing for those individuals. It makes a huge difference to their lives. It gives them opportunity to do things that they wouldn't have dreamt of doing without support in terms of glasses or lenses. And certain fields, it's very difficult to wear glasses and lenses. For example, extreme sports, skydiving, surfing, and things like that. So it just gives them a new lease of life. And ourselves as surgeons, we just love to see that in our patients.